Everybody, I'm Cliff, and this is Life with MS. Today, I have a very fun episode with very scary numbers in it. I'm going to tell you how long it takes people on average to get a diagnosis of multiple sclerosis in different countries. And at the end of this, I'm going to tell you what we can do at a patient level to help accelerate those diagnostic times. Let's get into it. If you didn't catch my episode yesterday, well, you may want to subscribe now because, well, you just want to be part of the cool crowd, right? Oof, that was cringy. Oh, okay. We're moving on. If you didn't catch my episode yesterday, I discussed all the misdiagnoses that people get sometimes because multiple sclerosis, by its very nature, can look like a lot of different things before it's determined to be multiple sclerosis. And that journey can be a long one. But that's not just the case here in the United States. And what I found is when I dug into the research last night and started putting all this together, there were some staggering numbers. What I started to realize is this is a multifaceted, very complex thing to quantify and qualify across the world. There are different types of criteria different places are using. There are different types of health systems. So what I did after looking at all the information, I broke down the numbers by time from first symptom to eventual diagnosis per country, and also what are and what were some of the challenges that specific country faced collecting that data. The data's all over the place, and the end story is basically we don't have an internationally standardized system of reporting this information. But regardless, there is some really interesting information, and the time from initial symptoms to actual diagnosis varies greatly across country. Let's get into it. So first off, what we do know is getting an early diagnosis is critical to some type of success fighting the disease, because this disease just gets wildly out of control when it goes untreated, well, at least in most people. We need to be able to pour DMTs on them, or we need to be able to figure out what kind of therapy they should be using based on what kind of MS they have. And the earlier we catch it, and in some people's minds, the harder we hit it at that time, the better off that patient is going to be in the long run. All right, now it's time to dig into some data. Ooh, tasty, tasty data. Data burgers. Nom, nom, nom. Okay, this data is really not that great, but it's what we have to work with. So keep in mind, I am not a researcher. I am not a PhD. I'm not a doctor of any type. I'm not even in the healthcare field. I'm a bald dude on YouTube with MS who likes to do research and find things out. And this is a good one. And basically, I think what you'll understand by the end of this episode is, diagnostic delays are a persistent global issue with multiple sclerosis. And the MS International Federation, in their Atlas of MS survey, even found a staggering 83% of countries reported barriers to diagnosis. 83%. That's a lot. That's like more than 75% and slightly less than 85%. I guess it could be worse. All right, now that we understand percentages, let's move on. Now, let's take a look at what the research tells us from different corners of the world and highlight some of the barriers to accurate information and ultimately a timely diagnosis. Okay, first off, we're going to start with Australia. The average time from symptom onset to diagnosis is still nearly 4 years. And while it's improved from over 5 years in earlier decades, that is still a significant wait. And what are some of the barriers to accurately diagnosing multiple sclerosis in a timely manner in Australia? Well, data often comes from patient surveys or older studies, which can be subject to recall bias. And if you're asking yourself, gee, what is recall bias? Well, if you remember statistics from high school, which I don't, basically it's the ability for someone to recall their information. And well, we know people with multiple sclerosis have really bad recall because we have memory issues because of cognitive decline or cognitive fatigue or cognitive just challenges in general. So what's the margin of error for accurate information regarding multiple sclerosis in Australia and getting a timely diagnosis from first symptom to final diagnosis? Well, I think it's really up to your great-grandmother's second cousin's uncle's aunt and whatever she remembers her first symptom being on a Tuesday when Jupiter was in line with Mars. Good luck with that. I'm sure that'll be really accurate. All right, now we're going to move on to Europe. All right, and this also is a large survey that I found that covers 22 European countries and revealed an average delay of 3 years from onset of first symptoms to final diagnosis of multiple sclerosis. Now, what are some of those barriers in the European countries that actually contribute to a delay in a diagnosis? Well, despite advanced healthcare systems, for the most part in Europe, there are issues like lack of accessibility to specialists, lack of accessibility to MRIs, and also a low public awareness of multiple sclerosis in the public eye. And then there's Germany, which is part of that study, but they had some additional information, and I'm going to read this here. There's been great progress for young adults 18 to 39 with relapsing MS, cutting the average time to diagnosis to just less than 1 year. It's fantastic news because, man, that's a great age to be diagnosed quickly because you can actually do something about this stupid disease. However, for older patients, 40 to 50 years old, the improvement is less dramatic, still around 1.3 to 1.4 years. And pediatric MS diagnosis also remain at longer at nearly 3 years. So what are some of the barriers we see in Germany? Well, while they've improved with the MRI-based criteria specific to patient subgroups like older adults and children, they still face unique diagnostic challenges that aren't fully captured by overall averages. So do better, Germany. You got this. I know you got this. All right, now we're going to cover the one everybody's been waiting for. Okay, probably not everyone, but most of the people watching this channel are from this place, and that would be the United States of America, which now includes the Gulf of America. What the heck? Anyway, now, you would think, as being the first world country that is like responsible for most major medical accomplishments and breakthrough technologies, we would have our shit together, but we don't. And that's no big surprise now. And if your confidence in our data findings is waning because, well, the guy now leading the charge and collecting this type of data has had half his brain eaten by a parasite, you're not in that boat alone. But I'm a little bit biased, and I wouldn't say in a good way, because it took me 10 years to get a diagnosis. But that was partly because I was a young guy and I was kind of dumb and I kind of didn't take my doctor's advice, but also because the healthcare system kind of sucks. And usually not because of the people working in the healthcare system, but the people managing the healthcare system, in my experience. I said it, okay? I'm guilty. I said it. I'm saying what I'm thinking here. That's what this is all about. So Georgetown MS Center discovered in one of their studies that the Hispanic population had a diagnostic time of averaging 23 months compared to 13 months for a non-Hispanic or white patient population. And also, my research found something else here. It says a broader patient registry survey showed that a median of 2 months from symptoms prompting evaluation to diagnosis. But if you include those earlier unevaluated symptoms that were later recognized as MS, that median jumps to 5.4 years. 5.4 years. 5.4 years. Now let's look at that 5.4 years. What can happen in that 5.4 years that could lead to catastrophic outcomes with multiple sclerosis? Well, I went from having mild, fuzzy stuff from my optic neuritis to pissing my pants in public. This is not okay. Now, that was 10 years, but by 5.4 years, I had recognized that I was having serious issues, but everybody was telling me, oh, no, you just have issues with your spine. You've got a pinched nerve. You've got this, you've got that, you've got chronic depression. Oh, by the way, you might be bipolar. We'll put you on some bipolar medication, which I totally wasn't. I was having bad fatigue one day, feeling fine the next day. And for some reason, I just slipped through the diagnostic cracks. And now I'm a hot mess here on YouTube complaining about our healthcare system here in the United States. But what are some of the barriers to collecting good information in the United States? Well, here's what my research found. Disparities based on ethnicities, socioeconomic factors. So what are our barriers in the United States to accurate information from first onset of symptoms to actually getting diagnosis of multiple sclerosis? The disparities were based on ethnicity and socioeconomic factors mainly, but we can also throw in there things like privatized healthcare systems, and total profiteering. I added that last one. All right, then we got our friends up to the north, Canada. Hi, Canada. How are you doing, Canada? Now, Canada was thoughtful enough to have national data, and from 2010 to 2011, it indicated an average of about 5 years from symptom onset to diagnosis. Women experienced a much longer delay of 5.4 years versus 2.6 years in men. Why would that be? Do they have barriers to accurate information in Canada? Well, sure they do. And what are they? Here we go. Data can be older, and anecdotal reports suggest variability in wait times for specialist appointments and diagnostic procedures. Okay, so that's fair. In a socialized healthcare environment, I could see how it might take a little bit longer to see a specialist. But here in the United States, where capitalism rules and we pay out of pocket for our insurance most of the time, and it's super crazy expensive and lands most of us with chronic conditions in the poorhouse or completely bankrupt and broke, it's not getting any better. I'm telling you, it takes a long time. I have been off my medication for some time now for multiple sclerosis, and the earliest I could get an appointment with my neurologist, who's a great neurologist, was over 6 months away. Is that different in countries where they're not paying out of pocket? I don't know, but I've been told it's not. All right, now let's look at Latin America. Those are the countries south of the United States, and there is a positive trend here. Yay, Latin America, you're doing it. Now let's read more about this. They've adopted updated diagnostic criteria to begin with, and they've gone from the average time of first symptom to diagnosis before the year 2000 of 21 months to 8 months between 2017 and 2019 when the survey was done. That's a huge improvement, people. But what are their barriers to accurate information? Well, they still have a lot of challenges around comprehensive care to their populations and also access to disease modifying therapies. So it's a work in progress. But overall, I give you a B plus. You're getting there. All right, let's move over to a different continent, the continent of Asia, where we have China, Iran, and Azerbaijan. And what are they doing? Let's see. China reported an average of 15 months. Iran showed varied results, with some studies reporting medians as low as 1 to 2 months, while others were higher. Azerbaijan reported almost 7 years. Gosh, that's a long time. Oh, wait, it took me 10. What are their barriers to accurate information? Well, let's see. One of their big barriers is robust epidemiological data. And one of those variables is including the diagnostic delay times, which are lacking for many countries in the Asia Pacific region, creating blind spots for our understanding. Blind spots are, of course, places we just don't have information from. What this basically tells me is we don't have enough information to feel confident that we're making forward progress with an early and accurate, timely MS diagnosis in those regions. All right, let's switch continents and let's talk about Africa and Egypt as the country. An Egyptian study reported a mean diagnostic delay of 18.6 months, with the median being at 3 months. But what were their barriers? Well, broadly across Africa, there is a severe scarcity of data. This is due to limited healthcare resources, inadequate diagnostic tools, especially when it comes to MRI accessibility. This is all combined with a severe shortage of trained neurologists, especially MS, multiple sclerosis neurologists, and insufficient disease awareness among both public and healthcare providers. Patients often endure symptoms for years before getting a diagnosis. Okay, so on a global scale, what can we do as a global community to make things better? Well, here's 5 tips, but then we're going to talk about what can you and I do as patients to make things better and get these huge long wait times down and stop this disease before it gets started. Well, I think first of all, we can increase awareness. We can educate people about early MS symptoms and also some of the things that are seen and misdiagnosed that eventually turn out to be MS symptoms. See my last episode for that. Number 2, better professional training, ensuring that primary care doctors can recognize multiple sclerosis and basically send you a referral to the right people early on in the game. Now, I will tell you firsthand that my primary care provider had no idea what was going on with me. My psychologist had no idea what was going on with me. And I even was sent to a cardiologist because we thought my lack of energy might have been a heart condition. All this crap took years before I actually got to an MS neurologist and got a decent and accurate diagnosis. And when I go back and I look at my medical records from the very first time I ever said anything to my GP, general practitioner here in the United States, it was so clearly obvious I had multiple sclerosis. I was basically a textbook example of someone with MS. We missed it, we missed it, we missed it. So we got to do better. Number 3, universal access. We got to be able to basically make sure people have access to not only the neurologist, but the MRI machines and the diagnostic criteria. This is the only way we're going to catch these people before they fall into the pit of hell that is MS, and too late in the game to do anything about. Number 4, addressing disparities. I mean, life's not fair, but it's really unfair when you have a chronic condition and you live on planet Earth uh, basically you are going to be put through the washer and be left to find your way on your own. And we need to fix that. Now, that's way above my pay grade. I don't know what that looks like, but basically, actively work to understand and dismantle the unique barriers faced by different ethnic, socioeconomic, and geographic groups. And last on this list, but not the list overall, I have to tell you, this one I think should be number one. It's standardized data. We can't draw conclusions on just completely random data. There are so many studies that I found, like hundreds of them, and the data is all over the place. The data points are all over the place. Different studies were looking at different points of data. And while we can draw some conclusions and parallels, it is just way too fractured to make anything of accurate sense out of it. So that needs to be standardized. We can do this, people. We are a global community. We can do this. Now, what can we do as patients to move these balls forward? All right, number one, I think this is pretty simple. It seems simple, but it can be complex sometimes. Be prepared for your doctor's appointments, right? Like, let's not waste their time. Let's make the best use of time, get as much information and communication as possible, and do the best we can and be efficient. That's pretty simple. Number two, advocate for ourselves, like communicate clearly and persistently. Let's not downplay our symptoms. Let's stay on this thing. Let's attack this thing like it's nobody's business. And then people know we're serious about getting better. And if you're not getting the answers you need, ask for your referrals. Get those referrals. Number three, understand the diagnostic criteria. We can do this. We have access to all this information. When our neurologist sets up to give us some kind of MS test or multiple sclerosis test, we can look up what these tests are, what they mean, and how effective they are. And we can help our neurologist decide if that's the right test for us. Like, we have to play an active part in this. Number four, we got to seek specialists early. We can't wait around for MS to determine our fate. We also can't wait around for other people to let MS determine our fate. We need to actively and aggressively go after this thing and basically push the crowds out of the way and go to the specialists we need to see to get better soon. And this is just speaking from personal experience, but if you are newly diagnosed or going to be diagnosed, you think you're going to be diagnosed, make sure you get a neurologist with an MS specialty. Not all neurologists know a lot about MS. Some of them do, but an MS neurologist that has a specialty in MS is going to know a lot more than your average neurologist. And I see a lot of people have not great outcomes if they're seeing just a general neurologist to treat their MS. Now, number five, we may not have ideal healthcare in the United States, and I don't think healthcare is great anywhere in the world. It's a very complicated thing. It's a very expensive thing. And I think people are doing the best that they can with what they have. There are a lot of resources we can leverage outside the healthcare system here in the United States, starting with things like the National Multiple Sclerosis Society. They are just a fabulous resource for people living with MS and even caregivers for people living with MS. Then there's the MSAA, which is the Multiple Sclerosis Association of America, another good source of information about support and multiple sclerosis in general. In summary, it's like, let's just be proactive, self-advocating, meticulous, symptom tracking, crazy nut job MS people that are just not going to stop until we figure out how the hell we get rid of this disease and take care of ourselves. So now it's your turn. Were you expecting these long wait times in different countries? And also, how long did it take for you to get an accurate diagnosis? Like I said, for me, it was 10 years. Comment below. And also, don't forget to click, share, like, and subscribe if you found this information helpful. I really like doing these little research pieces because I learned so much, and it's usually like mind-blowing information. Who would have thought 7 years in some countries? And who would have thought 5.4 years in the richest country in the world? That's crazy. That is just nut job ball nuts. And we can do better. We really can. I'm Cliff. This is Life with MS. I'm not a doctor. I'm not a therapist. I'm not a healthcare worker. I'm a bald dude on YouTube with MS, just having fun building a community. And until next time, I'm out.